So we sometimes look at the back of the leg and think of the femur kind of coming up the middle of it, but it really doesn't. The femur starts in the middle and then it drifts lateral, 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 lateral until it gets to the trochanter, and then it dives more medial to create the ball that fits into the pelvis. And so that's important for us because we're going to get access to not only the medial hamstrings, semimembranosus, semitendinosus that are coming down, but as we get a third of the way, halfway up the leg, we're actually going to start getting some of the lateral hamstrings as well, because the bicep femoris is starting lateral, but it's tracking toward the ischial tuberosity. So once we get to about here, as we're doing this technique, we're also going to be grabbing the so-called lateral hamstring, also, even though we're moving in a medial direction. We also have adductor magnus, which has a large insertion along the femur and some of the other longer adductor muscles. And so this technique is such an important one because we're gaining access to so many different muscles that are critical for movement, posterior chain and adductor muscles. And we're moving in a direction where we're pulling those tissues away from the femur. So we don't have to worry about the sciatic coming down as much. If we were driving a different direction, we might be driving the sciatic nerve into the femur, and that would be a big problem for us. Because of the directionality of this techniques, we're pulling the tissues away from the femur, and therefore the sciatic nerve is just moving with these tissues, but into a space that only has other soft tissues in it. So we're not driving it into something firm where we're going to pinch something and create pain or dysfunction in any way.